while I was working as a doctor at MGH and early in this program. And we had a clinic at MGH for street people, which we started way back about 30 years ago. And one day, there was a tour being led by this tall, kind of elegant man that came into the waiting room where our clinic was. And mind you, the hospital had let us have this clinic dedicated to people coming right off the street. So they couldn't shower. Many were, hadn't eaten in a long time. So we had coffee and donuts. We were trying to make it a place where people could feel welcomed by the hospital. And this tour of kind of bigwigs came through, led by, as it turns out, Jack. And he, as the tour started to leave the room, he came back in and he was stunned that Mass General was holding a clinic for these very neglected and usually excluded folks. And he came up to tell us thank you for doing it. And I will forever be thankful to Jack in that moment when he came and made that connection. And from that moment on, he never let us go, so he'd call on the phone, assured us whenever we need anything, we should give him a call. And trust me, we called him a lot, but he never, ever forgot us. He genuinely cared about all of us. And so, as probably a little hackneyed to say, but when Jack was with you, you just got the feeling you were his best friend. And he just had that unbelievable ability, which I think we embrace, because when you're taking care of homeless people, one of the real challenges, how do you make sure people feel welcomed and embraced? I guess that's where Jack, in many ways, was our mentor and inspiration. Jack taught us, I think, how we were all brothers and sisters. We weren't different from one another. And that his ability to erase those differences or ignore the differences and embrace people for who they were was truly inspiring. I remember in the most recent gala we had when Jack was there, I can remember we have several formerly homeless people and currently homeless people are on our board of directors and our consumer advisory board. And some of them were in a wheelchair and having trouble. And I remember at the gala, Jack coming over, talking to them, and then leaning down so that he'd be at their level to have a picture. And I guess if anything symbolizes to me what Jack was able to do, he was able to scale from the heights right down to the streets where we were working. It was effortless. He just seemed naturally there. So that ability to just always be naturally with the people he was around, no matter who they were, whether it was President Obama or our consumer board members, it was just stunning. One of his favorite things to do was walk with his wife Eileen through cemeteries, and he would love looking at the epitaphs on the gravestones. And he had lots and lots of stories, but the one that he most cherished was on one gravestone was a thing that just said he went about doing good, and he said, That's what I want. I want to live a life so that can be on my gravestone. So if I think of one very special thing that Jack has done for us at Healthcare for the Homeless, it was when we had a chance to get the old Mallory Institute of Pathology, which was on the grounds of the old Health and Hospitals, Boston Medical Center, Boston City Hospital. And Mayor Menino said we could have the building for $1 a year, which, by the way, he came and collected that $1 every year, if we could renovate it. And this was not insignificant. At the time, we thought we were going to need somewhere between $12 and $20 million. Turned out to be almost twice that we needed. But because of what Jack did, we were able to do that over the next 3 or 4 years. And he was at our sides through the entire thing. So our ability to have now a real anchor building where we have our McGinnis house and our pharmacy and our dental clinic and our offices all right across from the emergency room at Boston Medical Center is all because of what Jack did. And because of this, we've been able to grow in ways we never thought about. We've been able to respond to all sorts of crises from a public health perspective, like COVID. And then we've been able to care for the chronic diseases that are so prevalent among our population. So we have a really aggressive hepatitis C program. We take care of an awful lot of people who have AIDS and are now on medications and doing really well. And then we just have a daily clinic where we take care of, diabetes and heart disease and lung disease. And all of that, I think, is now offered in this kind of really dignified way because Jack sort of paved the pathway for us to be able to move into a place like this. You know, the evolution of the friendship I was able to have with Jack and the friendship our Healthcare for the Homeless program has had with Jack, I think I go to when he got sick. And I remember sitting with him and I was trying not to bother him, just to say hello, and he insisted that I sit down. And he was reflecting on his life, talking about how lucky he's been. He was 82. He had a great family that he adored. His wife, Eileen, had been at his side his entire life, and he cherished her. And then it talked about his grandchildren as well. But then he was saying that, you know, what do you do when you're sick and he might not make it? And I'll never forget, he said, you know, I'm not going to like this, he said, because I want to hang around a lot longer. He said, but there's still time to do some good. And I remember stepping back and going, here's this man just, you know, his body being ravaged by this awful cancer, still thinking about how in the little time he had left, he could still do some good. So if there was a lesson I think that Jack gave certainly to me, but I would say to everyone, you know, that's what we should be doing. There's still time to do good, and if that's in our mind and our hearts, I think that's a legacy that I want to think of as Jack's.